There has been an increase in COVID-19 cases among families during the second half of November when compared to the first half of the month. Geographic Information Systems Manager, Epidemiology Division, Roshan Seeram-Singh said there was an increase in the number of cases within the home from 6 cases between the period 1st and 14th to 8 cases between the period November 15th and 29th.
The cluster within which that home was located had a total of 15 cases. Interestingly, the other 7 cases also came from a singular home. So one cluster, 15 cases, all coming from 2 homes, which emphasizes for us and highlights for us the risk that is there for spread within the home.
Mr. Seeram-Singh said there have been increases across the board during the second half of November.
Indicators mentioned there was an increase during the second period, which is the 15th to the 28th of November, when compared to the first period, the 1st to the 14th. The total number of clusters increased. Again, does not include the prisons. The total number of cases within the clusters increased. I'll point out as well that there were more persons per cluster during the second period, which is the 15th to the 28th of November, than the first period, which was the 1st to the 14th.
He said the highest number of cases within any cluster was recorded in the San Juan to St. Joseph area. Mr. Seeram-Singh also noted an increase in the number of clusters emerging in Central and East Trinidad and Sangre, Grande. The Ministry of Health says there have been 17 new COVID-19 cases reported from samples taken in the last 3 days, bringing the total number of cases reported to date to 6,917. The number of active cases has gone down to 564. 27 patients are at hospital and 1 of them is in ICU. There have been no new deaths. That figure remains at 123. 13 patients have died at Cora Hospital from COVID-19 between August and November. Thoracic Medical Director at Cora Hospital, Dr. Michelle Trotman, provided a demographic breakdown of the deaths at Wednesday's press conference.
Most of them occurring in September and in October, 5 each. And I would like to break down for you here the ages of those people. Of those 13 deaths, 6 of those deaths were in people over age 65. 75% of those deaths are people with comorbidities.
While she said the deaths are similar to those across the country, she said patients at Cora Hospital also include those from the working population.
And what we are seeing now in some of the culture is that our age group 16 to 29, and look at where 30 to 44 is, actually leading in the age distribution. Those are young people. Those are people who are moving around. Those are people in our regular workday that are actually being affected with COVID.
Dr. Trotman said during the upcoming Christmas season, persons should remember to stay within their family groups, sanitize, wear masks, and practice safety distance protocols.